Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension, why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
Hi everyone, I am Dr. Tahir Khan, consulting general physician and diabetologist at Sagar Hospital, Hyderabad. And on 17th of May, as we are celebrating the World Hypertension Day, and I just want to give some glimpses of hypertension.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
Hypertension is actually it's known as it's a very silent killer, where people unknowingly with hypertension they are staying for a very long time. So because of that, it's like rust in the pipes, which slowly damages your kidneys, heart, and your brain. So that's why I want to say you that hypertension is very important, and you should monitor it regularly to know your hypertension.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
Yeah, it's a silent killer because people knowingly or unknowingly having a long time with hypertension is very dangerous. So that's why it's called as a silent killer. People unknowingly they are staying with dangerous hypertension for a long time. Because of that, the people are suffering with some cardiac problems, strokes, kidney disease, and everything. So according to World Health Organization, it says that about 10.8 million people are dying per year, out of which 57% considered from heart stroke and other are from brain stroke. And according to Lancet also, we are seeing that 57% of all the deaths is due to heart stroke.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
Yeah, obviously it's mainly lifestyle, because today's generation we have seen a lot of people they don't maintain the lifestyle. They are like not up to the mark. They are taking outside food, junk food, and everything. So when it comes to genetics, yeah, definitely genetics also plays an important role. The people with family history of having hypertension, they have the double chances of getting the hypertension. So and about 5 to 10% are with secondary hypertension are due to hormonal imbalances or any kidney problems, etc.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
Yeah, well, according to American Heart Association, it says that anything above 130/80 is considered as hypertension. So the person who wants to be know whether he is hypertension or not, then he need to do he need to monitor his blood pressure every day, morning and evening, for 3 days, so that we can diagnose whether patient is hypertensive or no.
So, I would also like to know if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
Modification and have a good sleep and salt intake restrictions, and like at least brisk walk. If you're not able to do any exercise, then you should do aerobic also, swimming also, cycling also, and according to that we can restrict our hypertension to be on the higher side as well as, and we can make it controlled.
Can we say that hypertension can be treated without medication?
Yeah, I just want to tell them that first maintain your all the lifestyle, like you just go for physical activity and like to obstruct your salt intake and to have stress-free life and have a good sleep, and anything which makes you stress, that is the important, it plays a very important role in your hypertension.
Okay, doctor, you just talked about medication right now. So, I would like to know what are the most common side effects that people should look out for while taking medications for hypertension.
Stress is definitely it's one of the main cause for hypertension, and I just want to say you that the people with stress will definitely have hypertension because of that they have the high lipid levels in the body, and because of the stress they will have cortisol level also more, which makes definitely increase blood pressure, and it will finally damages your kidneys and liver, everything.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
Yeah, actually it's a lifelong commitment. Hypertension is lifelong commitment, because by having some changes in your life, just you can titrate the dose, like we can reduce the dose of your medication, but we cannot stop the medication.
Okay, when you say reassess regularly, how often people should check their blood pressure, and what's the best way to do it right?
Yeah, definitely. See, if what happens when the people feel happy, so when the people feel happy and healthy, so it does not mean that they don't have hypertension. Regularly monitoring is very much important, and genetics also it plays a very important role in that. If the patient genetics, like past their history is there with hypertension, like if their father and mother, everyone, they have the more double chances of risk of having hypertension. So I just need to tell them that regular monitoring is very much important.
I would also like to know what would happen if high blood pressure gets untreated for years, especially the body parts which gets affected the most.
On 17th of May, as we are celebrating the Hypertension Day, so I just want to conclude this session with a small note saying that these days, hypertension is the most common problem we are seeing with all the patients. So I just suggest all the people and listeners and everyone that hypertension it's like a silent killer. Please don't neglect it, and have a checkup every time when you get a time, and please have a look on your sugar blood levels. So please take care.
So, this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share, and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off on this podcast, Win Over Hypertension.